Good day everyone, I am Savin Rain Fermil from BSN 1A and today I am going to perform an unoccupied bed making. First step is assess the client's health status if he or she can safely get out of bed. Good day sir, I am Savian, your nurse for today. May I know your name and your birth date?
Richard Solomon, January 1, 1991.
Okay, Sir Richard. I am here to change your linens. Are you able to sit up?
Yes, I can.
Okay, sir. If the patient is able to sit up, assist him to sit on the chair and don't forget to check his pulse and respiration if indicated and take note all of the tubes and equipment that are connected to the client. And of course, don't forget to provide for client's privacy. In connection with this, we must also close the curtains. Make sure to wash our hands and observe for proper infection control procedures. Next step is to place the client's fresh linens on his chair or overbed table. We should always remember that we should not make use of another client's bed to place the fresh linens.
And of course, do not forget to sanitize our hands and put our gloves on. Gather the linens and place them on a clean surface in the room in the same way that they will be placed on the bed. Make sure that the linens do not touch your uniform to avoid contamination.
Before stripping the bed, we should always check for the client's belongings, like this one, and put it in a secure place. And we should always remember to observe body mechanics to avoid any injury. We should adjust the height of the bed in our comfortable working height.
Remove the pillowcase and place the dirty pillowcase at the center of the bed. Place the pillow on a clean surface in the room. Remove the soiled bed linen by rolling it inwards toward the bottom edge of the bed. Rolling the soiled linen inward prevents secretions from scattering. It also prevents transmission of microorganisms to the worker.
Now we are going to dispose the soiled linens or the used linens in a hamper or in a linen barrel. After disposing the used linens, do not forget to disinfect the bed with the use of clean cloth and antiseptic.
In disinfecting, make sure to wipe from farthest to the nearest.
Again, remove the gloves and perform hand hygiene. Wear a new set of gloves before putting the new set of clean linens.
Place the folded bottom sheet with its center fold on the center of the bed. Make sure the sheet is hem side down for a smooth foundation. Spread the sheet out over the mattress and allow a sufficient amount of sheet at the top to tuck under the mattress. Miter the sheet at the top corner on the near side and tuck the sheet under the mattress, working from the head of the bed to the foot. Make sure to do it on the other side. This is an improvised waterproof draw sheet with its own cover for me to be able to tuck it in. Place it over the bottom sheet so that the center fold is at the center line of the bed and the top and bottom edges extend from the middle of the client's back to the area of the mid-thigh or knee. Fan fold the uppermost half of the folded draw sheet at the center or far edge of the bed and tuck it in the near edge. Next is place a draw sheet over the rubber sheet and fold it properly. Now, place the top sheet over bed and fold it out properly. Tuck the foot part of the bed. And perform a half miter. Don't forget to do it on the other side. This is a regular pleat procedure. If the door of the room is on this side, make sure to make an opening. For the next procedure, let us do the vertical toe pleat. Make a fold in the sheet 5 to 10 centimeters or 2 to 4 inches perpendicular to the foot of the bed. And for the last one, we will be doing a surgical pleat. On the side of the bed where the client will be transferred, fold up the two outer corners of the top linens so they meet in the middle of the bed, forming a triangle. Pick up the apex of the triangle and fan fold the top linens lengthwise to the other side of the bed. Leave the bed in high position with the side rails down. Lock the wheels of the bed if the bed is not to be moved. After making the bed, gather up the sides of the pillowcase and place them over the hand grasping the case. Then, grasp the center of one short side of the pillow through the pillowcase. With the free hand, pull the pillowcase over the pillow. Adjust the pillowcase so that the pillow fits into the corners of the case and the seams are straight. Place the pillows appropriately at the head of the bed.
After making the bed, make sure to remove your gloves and perform hand hygiene. After performing hand hygiene, make sure to help the client on going back to his bed. That will be all. Thank you. Good day everyone. Again, I am Sabian Rainformil from BSN 1A, and today I am going to perform the occupied bed making. The very first thing to do is note for specific precautions from moving or positioning the client. The next thing to do is to determine the presence of incontinence and excessive drainage from the other sources, indicating the need of protective waterproof pad. And of course, assess the skin condition and the need for a special mattress, footboard, or heel protector. The most important thing to do is to always wash your hands and observe the appropriate infection control procedure. Do not forget to provide the client for privacy. Sir Richard, I am Sabian, your nurse for today, and I am here to change your linens. Do you think, are you capable to cooperate to move sidewards?
Yes, I think I can.
Okay, sir. Thank you very much.
Spread the bath blanket over the top sheet. Ask the client to hold the top edge of the blanket. Reaching under the blanket from the side, grasp the top edge of the sheet and draw it down to the foot of the bed, leaving the blanket in place. Remove the sheet from the bed and place it in the soiled linen hamper. Next is to get the pillow and remove its pillowcase. Put the pillowcase on the hamper and place the pillow over the head of the client. Ask the client to turn on the side facing away from the side where the clean linen is. Untuck the dirty linen and roll it inwards as near as from the back of the client. Place the new bottom sheet on the bed and vertically fan fold the half to be used on the far side of the bed as close to the client as possible. Tuck the sheet under the near half of the bed. Place the clean waterproof draw sheet with its cover on the bed with the center fold at the center of the bed. Fan fold the uppermost half vertically at the center of the bed and tuck the near side edge under the side of the mattress. Place another draw sheet over the waterproof sheet on the bed with the center fold at the center of the bed. Fan fold the uppermost half vertically at the center of the bed and tuck the near side edge under the side of the mattress. Ask the client to roll over toward you onto the clean side of the bed. Have the client roll over the fan folded linen at the center of the bed. Remove the used linen and place it in the portable hamper. Unfold the fan-folded bottom sheet from the center of the bed. Facing the side of the bed, use both hands to pull the bottom sheet so that it is smooth and tuck the excess under the side of the mattress. Unfold the draw sheets fan-folded at the center of the bed and pull it tightly with both hands. Pull the sheet in 3 sections. First is face the side of the bed to pull the middle section. Next is face the far top corner to pull the bottom section. And last is to face the far bottom corner to pull the top section. Tuck the excess draw sheet under the side of the mattress. Reposition the client in the center of the bed. Determine what position the client requires or prefers and assist the client to that position. Apply or complete the top bedding. Spread the top sheet over the client and either ask the client to hold the top edge of the sheet or tuck it under the shoulders. The sheet should remain over the client when the bath blanket or used sheet is removed. Tuck the foot of the bed sheet in under the foot. And finish the bed by making a loose hospital corner. Make a toe pleat so that there is room for the client to move his toes. And finally, put a clean pillowcase on the pillow as required. Grasp the closed end of the pillowcase at the center with one hand. Gather up the sides of the pillowcase and place them over the hand grasping the case. Then grasp the center of one short side of the pillow through the pillowcase. With free hand, pull the pillowcase over the pillow. Adjust the pillowcase so that the pillow fits into the corners of the case and the seams are straight. Place the pillows appropriately at the head of the bed and assist the client.
After making the bed and ensuring the continued safety of the clients, do not forget to remove your gloves and sanitize your hands. That would be all. Thank you.